Allen, President of the Carroll County Chamber of Commerce, and I want to welcome you to our Zoom meeting featuring Health Officer Ed Singer and the President of our Commissioner Board, Ed Rothstein. We're going to be talking a little bit about COVID-19, little history, current days, and hopefully brighter days ahead. I'm sure we'll touch on topics like the vaccine. And I know that Commissioner Rothstein is going to be talking a little bit about the 1.9 trillion that just passed in Washington and what that looks like for our local area, what kind of money might be flowing down to us here. So again, I want to welcome you all and give some basic Zoom instructions. You probably don't need it, but it's always good to have a refresher. If you are at this point not muted, you should mute yourself because it interferes with when somebody's speaking. You even touch something and all of a sudden you're on the screen. Also keep in mind you're on the screen. If we can see you, if you can see yourself, we can see you. So if you need to get up and leave the room or something, stop your feed so we can't see that happening. It just is a little bit nicer to not do that. So again, I want to welcome everybody. We have almost everybody here. What we're going to do is we're going to have the ability to ask questions through the chat feature. And you should all know where that is at this point, at the bottom of your screen. And if you type in a question, we will work to get to those. We're going to have Commissioner Rothstein speak first. And when he's finished, if you have any questions for him, you can type those in because he needs to leave a little bit before 1. And Ed, the other Ed, we've got 2 Eds. I heard it said that 2 Eds are better than 1. So I don't know. That's a horrible joke, but I heard that. So we'll have him speaking and we'll be able to go past 1. Other than that, I'd like to introduce you to our actual chair of the board for this year. He's a great guy, Mr. Steve Aquino from Aquino Financial Group, to say a few words. Steve?
Well, thank you, Mike, and thanks for having me back after 10 years as chair in our crazy times of COVID. But what a great job you and the chamber staff have done in keeping us all together and providing another great presentation today. Thank you for everybody for attending, for all of your support. Obviously, we all look forward to this presentation. Obviously, it's timely and important to all of us here today as businesses. I hope you all enjoy it. I look forward to seeing everybody hopefully here in person soon, and hopefully we'll have a better idea by the end of the program today. Thanks to our sponsors, and thank you, Ed, and the awesome health department. And thank you, Commissioner Rothstein, for all your time and all you have in store for us today. In the meantime, just please continue to stay involved in the many programs available through the chamber, and remember to keep supporting each other. And with that said, Mike, I pass it back to you.
Thanks, Steve. Okay, some upcoming events. Steve mentioned them. You can find all these on our website by going to carrollcountychamber.org. March 24th, we've got 3 things happening. 8 a.m., we're doing something new. It's kind of cool. It's called Chat with the Chair. Steve comes on, I come on, we do a little Zoom call. We have 2 or 3 of the members, and we just kind of talk about life and how things are going for them. It's really been going well, and we'd love to have you get involved in that. So you just have to go to our actual website to register. And then that same day, March 24th, around 12:30, we have one of our new member orientations, which is not just for new folks. You can get involved in that to get a little update again on what you can do through the chamber and what it is that we do. And then March 24th at 6 o'clock in the evening, we're doing Outstanding Teacher Awards. It's going to be a live stream. There's no Zoom aspect to get involved, but we're going to have the event. It's going to be streamed by our friends from CMC, just like they are doing this event and so many of the other events we've done over the last year. And you'll be able to see it, I believe, on their Facebook page, on their YouTube channel. I think it's also going to be on Comcast 1086 and Channel 19. The same thing is that you get with all the other meetings like the one today. On March 29th at noontime, we're going to have a grand opening. Those are always fun at Mission Barbecue in Westminster. So that sounds really nice. We're also going to have on March 30th at 4 p.m. a virtual PM connection, a virtual after-hour event, which is a lot of fun. It's a new platform that we have, and I think you guys will like it. We've done it one other time, so please check that out. Give you a chance to kind of meet and greet people again. We'll be going with live events soon. Hopefully, we're going to hear today that we can go with live events even before we wanted to. So, but in the interim, this is going to be a lot of fun. This will be a nice event. April 15th at noontime, we're going to do our legislative wrap-up with our delegation from Annapolis, talking about how things went there, what kind of bills passed, what that will do to you. And it's a great event. It's free. It's another Zoom event we're going to do at noontime on April 15th. On May 18th, 8:30 in the morning, we have another Zoom event, and it's free. We did this last year. We're going to have Anirban Basu come in and speak to us. If you've never heard him, he's hysterical. He's smart. He talks about economics and how things are going to go in Carroll, his outlook for Carroll, for Maryland, for the entire U.S. And it's a great event. We had like 400 on the call last year, so please do get registered for that. And then we have a luncheon that we're doing. This is a live luncheon. We have limited space for this one. We're going to ease our way in. That's May 20th. It's a noontime luncheon, and we're going to have the outgoing president of McDaniel College, Roger Casey, and the incoming one, Miss Julia Jaskin. So that ought to be a really great meeting, and it should fill up really fast. So you want to make sure you get registered. And again, all of these events you can register by going to carrollcountychamber.org. You can also find a link there to apply for the Carroll Biz Challenge, which is our absolute marquee event we do every year where local entrepreneurs pitch their ideas. This year, it's our 10-year anniversary. The grand prize is going to be cash of 10 grand and about 20 grand in other things that are being given to them. So that is going to be awesome. You also want to look to our website. And if you are now joining us, please make sure that you mute yourself when you come in. We're going to also have our application for Leadership Carroll, the class of 2022. So that's going to be great. Other than that, those are my announcements for events. So I want to introduce you to our sponsors of today's event. And sponsors are very important to us at the Chamber. And if you would like to get involved and sponsor any meeting this year or next, please do get in touch with me. We couldn't survive without the sponsors. In fact, we couldn't survive without you, because contrary to what some people think, we're not part of the government, and we're not part of some like actual chamber network like the US Chamber, the Maryland Chamber, and then down. We're a standalone nonprofit since 1924. We have 625 members, and we're out to do what we can for the business community. And that's all of you guys. So I want to introduce you to our first sponsor, and give the stage here to Miss Julie Piet Cassidy from the Alzheimer's Group. Julie, they're all yours.
Hey, thanks so much, Mike. And thanks everybody for being here today. It's such an important meeting. I'm not sure how well this will work in Zoom, but I have to do this. I would like it if you could use the little raise hand emoticon and let me know if you have any kind of connection to Alzheimer's or another type of dementia. I'd like to just take a moment and just get a feel for that. Okay. Yep. Okay. As I suspected, there's always a good handful of people in whatever meeting I happen to be attending and where I get to speak. And I like to do that just because I want you to know that I see you and that we're here for you. The Alzheimer's Association is the largest voluntary health organization involved with the educating, the caring, the supporting, and the researching and advocating for Alzheimer's disease and all other types of dementia. I'm located here in Westminster with all you guys. I'm part of the chamber, and we have an office in the Frederick area. But my purpose for being here today is to announce to you that not only are we here for you at all times, and I will put our information in the chat in case you'd like to take a look and get in touch with me, ask some questions. I'm here all the time. We have an event coming up, the Longest Day Walk in Westminster. This will be our second year. We will run it as a virtual event, but I urge you to please get yourself, your family and friends, and your organization involved. I will put the link for the website in the chat. Please take a look at it. $20 to register, gets you a t-shirt. The funds stay right here in our community, providing programs and support services for those living with the disease and their very hardworking caregivers. And another thing I'm going to ask you to do, please, if you hear of anyone who has a connection to the disease, mention our association. Less than 5% of those diagnosed with dementia in the state of Maryland know that we exist. And by the way, everything we do for our community members is free of charge. Thank you so much.
Julie, thank you. And yeah, it's a horrible disease. And I think what you guys do is awesome, is amazing, and is needed. And I really appreciate you being on this call, in this event with us today. So thanks. And you can also find her listed on the Chamber's website. We have our directory with all of our members right on the website. So our next sponsor, I'd like to introduce you to somebody who's been in this community for a long time, doing amazing work as well. And that is Ms. Janice Kispert from Rape Crisis. Janice?
Thank you, Mike. Good afternoon, everybody, and thank you for joining us today. Rape Crisis Intervention Service, as Mike mentioned, we're a standalone nonprofit, just like the Chamber. We are your Rape Crisis Center for Carroll County, been around over 40 years, and we rely heavily upon the local community to support us. We help victims 12 and older who have been affected by sexual violence. We've been hit very hard with the COVID as far as funding. We've had to downsize our staff. We couldn't have our fundraiser in the fall. So what we're doing now, again, we have our 13th annual Walk 'Em on Her Shoes event coming up. We're asking for your support again this year. And I know Dave Bollinger, right, Emily, is heavily involved. And it's a Walk 'Em on Her Shoes event. We ask men and women to take a stand against sexual violence. This year, again, we're changing the event to a virtual event, Saturday and Sunday. It's a 2-day event, April 10th and 11th. Registration is $10, $5 for children 12 and under. You can register on our website or go to www.walkamilec.org. We are also asking for sponsors. But when the event is live, there's nothing like watching Dave Bollinger walk down Main Street in 2-inch heels. It's a sight to behold. So if you can join us this year, love to have you. You can do it virtually, take a picture, send it in to us. We'd love to have you participate. And all funds raised go right back into helping our victims. It stays right in the community. We do not charge for our services. So thank you all, and I'll put the website in the chat. Thank you.
Janice, thank you. You guys do amazing work as well in this community, and I want to thank you for that.
Thank you.
Like somebody wrote, Emily just wrote, Dave has the best legs around town. Yeah, that's great. That's great. All right, so after that, we have our last actual sponsor of the day, and this is a sponsor and a partner that we really couldn't have done the events that we've done over the last year without, and that is our amazing friends at CMC. And today we have to speak for them is Sheri Taylor, the marketing director for CMC. Sheri, they're all yours.
Thanks, Mike. It's great to see everybody here this afternoon. Actually, I feel like it's morning. But we at the CMC are really proud to be the Chamber's media and streaming partner to help get this important information out to our community. You know, last March, I don't think any of us imagined that we'd be sitting here dealing with the virus to this extent 12 months later. COVID has just impacted every aspect of our lives, how we work, how we play, how we interact with our family and friends. And it's really been a year of just learning how to adapt to all those rapidly changing conditions. And I just really want to thank our county commissioners and the health department for all the work that they do to keep our community up to date on the situation in Carroll County. I also want to thank my teammates at the CMC. Our production crew is actually the superstars. They're working behind the scenes to make this and broadcasts like it possible. And we couldn't do it without a great team. Richard was going to be with us today, Richard Turner, our executive director. Unfortunately, he couldn't join us, but if he were here, I'm sure he would remind you that the Chamber encourages everyone to buy local. And at the Community Media Center, we'd like to ask you to watch local. This meeting is being broadcast live on our cable channels, HD 1086 and channel 19, but you can also follow us on your favorite social media channels and then get notified when we have great content like this coming up. So subscribe to our YouTube channel, follow us on Twitter and Facebook, and visit our website for live streaming programs like the ones that Mike was talking about earlier, or to even to take back at some of the other programs that we've done with the chamber over the years. So thank you.
Thank you so much, Sheri. Okay, now we're going to move into the presentation portion of our meeting. And the first speaker we're going to have is Commissioner Ed Rothstein, who's president of the current Commissioners Board. And I've worked with a lot of commissioners in the last 10 and a half years. And I will say that he is one of the most outwardly friendly commissioners for the business community, always looking to support them. And it's great to work with him. I have a lot of respect for him, and I'm proud to introduce him to you right now, and that is Commissioner Ed Rothstein.
Thanks so much, Mike, and for all the chamber is doing, especially bringing this together. And I do believe 2 Eds are better than 1, so you're going to get the second Ed after me with a whole lot more knowledge and insight on what's going on, especially when it comes to COVID-19 and the vaccines. Sheri, thanks for also the support. I think Richard has maybe a face for radio, so I'm glad to see you today. And Janice with RCIS, I mean, y'all rock. And Julie, thanks for the Alzheimer's, information and dementia. Bottom line, it's reality. I do believe that rape, unfortunately, is reality, but should go away, period. Dementia and Alzheimer's is something that we all live with, recognize, and must, work through. So resources like you are very important. And that's from personal experience along with professional. There's a few things I want to share in the next, say, 15 minutes. I literally just got out of morning session and we're going back into afternoon session. So I appreciate the flip-flop. We go into afternoon session at 1 p.m. The few things I want to share that I did share this morning, and I know somebody mentioned about the masks. It is not a choice. It is a choice. The choice is you either abide by the law or you break the law. Whether we agree with it or not, it's regardless. People ask me if they can or cannot wear a mask. I said, you're asking the wrong person. The executive order came down from the governor, so it's up to him. Dress code, whether we wear a tie or not a tie, not such a big deal. Masks, social distancing, we're directed to do so. Speaking of the governor, I was told that he will be speaking at 2 p.m. This afternoon, focused on vaccines. So we'll see what he has to share. I know he's been pushing very hard with the regional centers, especially when it comes to the disadvantaged, the African-American Latino communities. I believe one of our communities that needs to be recognized, and Ed can get into this more, are the disadvantaged that are technically not savvy or are away from internet and are challenged in knowing where to turn to get their vaccine. If you know someone like that, do something about it. Neighbors, friends, community, that's what it's really all about. I did hear someone talk about shop and eat local. Absolutely. We try to do it, Audrey and I, not because we're lazy, but we just enjoy the community and the food and the variety, a couple times a week. Use our economic development team, in Carroll County. Jack and his team are doing phenomenal work. The challenge, I feel, is sometimes they don't know what the priorities are of the business. So if you can clearly share, articulate, whatever word you want to use, your priorities, and ensure that the chamber understands the priorities, understand the economic development team finds the priorities, it may allow us as a community in partnership with the government to go after some funds. If it's training dollars, that may be an opportunity. I'm always looking for opportunities to find funds and grants, especially if they're not ours. I love using other people's money, and there's a lot out there, which leads me into some overview. Unfortunately, I don't have too much specifics, but there's basically federal funds that are being put aside through the American Reserve Plan, and then the state has what's called the Relief Act. And the state with the Relief Act for us are focused on hotels, restaurants, and online sales. In Carroll County, it's been broken out that we should receive about $620,000 for our restaurants. We should receive $278,000, a little over, for our hotels and motels. And then online sales, almost $14,000. That was the breakout that I recently saw, I think as of a couple days ago, for that. Another project, and I know I'm throwing a lot of information, and I'm trying to do it quickly. So if you do have comments and questions and opinions, that's what I really want to hear from you before I have to sign off. Another effort that's going on is community project funding. What that is, community project funding, that is a federal program that's looking for innovative ideas and businesses to support nonprofits and governments, local governments, and using federal dollars. So if there's a project that you believe or a business that you have that can support a nonprofit or our county, then we from the county submit the request to the local representation. So that would be Congressman Raskin, Congressman, forgot his name, Republican. Okay, I forgot his name. That's bizarre. And then Senator Cardin and Senator Van Hollen. That hurts when I forget something like that. But that's a program, and they're earmarks that the federal funds have, set aside for us to support nonprofits and counties. It's called the Community Project Funding Program. The Federal American Rescue Plan is the $1.9 trillion, is the personal funding that you received, along with support to our counties. And what I want to share with you is, if you haven't seen it, it's important to understand where these dollars are going to go. Four things: to respond to or mitigate the COVID-19 health emergency or its negative economic impacts, including assistance to households, small businesses, nonprofits, and aid for tourism, travel, and hospitality. I'm going to go through this first. I'm going to talk then about the amount of dollars and how we're looking at using those amount of dollars. The second is to provide essential workers with premium pay. The third is to cover revenue loss as a result incurred as a result of COVID-19 emergency. And the fourth is to make necessary investments in water, sewer, or broadband infrastructure. What it cannot be used for is to support any pension fund or offset any tax cut. So you cannot use the funds to offset any of the tax situation. Overall, Carroll County is going to receive about $76.5 million. 32.5 of that $1 million, or $32.5 million, is going to go to the county. At this time, we, county government, is working to look at those numbers and how we're going to break it down. How much is going to go to economic development to then provide grants to you. Similar to what we did in the past with the CARES Act, and before that with our county dollars. I think we ended up giving around $12 million in grants in total from local, our money, state, and then also federal. So this is $32.5 million. The other piece, which is important, I believe, to you, is the municipal allocations. So if you're in the municipalities, they're getting allocated money, which is pretty cool because it's going to go directly to them. It's not going to go through state, through county to us or to them. It's going to go from state directly to them. Our money is going to go directly to us. So there's not going to be any filters. So just to put it in perspective, the municipalities. In Hampstead, they're going to get about $5.4 million. In Manchester, about $4 million. In Mount Airy, almost $8 million. New Windsor, $1 million. In Sykesville, 3.3 million. In Tawnytown, 5.7. In Union Bridge, 800,000. And in Westminster, over $15.5 million. The criteria used for each one of those is those 4 criteria that I mentioned. Everything I'm sharing with you is public knowledge. So if you reach out and you say, I want to know more about the Federal American Rescue Plan, specific Maryland, you're going to find this type of literature. It's just going to be in probably just a different format. But I don't know the breakdown, how the towns are going to break down their money. They're going to break it down in those 4 criteria. I think your voice matters. And I think from a chamber's perspective, you ensure that the communities, the jurisdictions, the towns, along with us, the county, know that you know this money exists and you know how is it going to break down. That's going to be very important. Trying to think what else I can share with you. The State Relief Act, I mentioned the money going to restaurants and hotels. We literally just got the letter. I think it was like yesterday with the breakdown. And I spoke to Jack Lyburn yesterday morning and the economic development team. They're having weekly meetings, I guess yesterday, Wednesday at 1 p.m. to get more guidelines. Right now, they don't have any more than what I'm sharing with you right now. But it's important. Knowledge right now is going to be very important. The other piece, the CARES Act and the distribution of money that we conducted from March, April through probably October, I thought went really well. But I'm still finding so many small businesses that just didn't know that this was happening. Sometimes you feel like they're living under a rock, and how do you not know as we're continuing to promote this? And Mike, you do a great job in promoting this, but there's just so many others that just don't know. And in the military, we say one team, one fight, and we got to just keep looking out for each other. That's my plea to you. So if you see, a business, say something to them. Have you gotten this? And when they say, well, we don't need it, walk them through how you may be using it for marketing for, some of the revenue loss, and they may end up changing their mind. Let me stop there. For the next 5-10 minutes, I'm still available, and then I am going to have to sign off. But if there's any questions, thoughts, opinions, ideas you want me to walk away with, please.
Thank you. Thank you. Yeah, I think at this point, it would be nice because we know that Commissioner Rothstein will not be around any later than about 5 to 1. If you have any questions that would be specifically for him, we do have a chat thing here. The name that you were searching for would have been Congressman Harris. So,
there you go, man.
There you go.
That was bad.
I don't want to interrupt you at that time, but
no problem.
all right. So does anybody have any questions specifically for Commissioner Rothstein at this time? I'll give it a couple seconds. If not, we'll be moving on to hear from Ed Singer. Okay, what is it? Speak now or forever hold your peace. You're going to have to hold your peace because what we'll do now, Commissioner Rothstein, is we'll have you mute yourself.
Mike, do
Sounds
you see the
good.
hands raised?
Oh, I guess I didn't see that. No, just in the like actual chat box. But if you've got a question, go ahead and ask it. Julie, okay.
There's a couple of hands raised. I don't know if that's from the past or are they asking questions?
I'm looking for those are from before, I believe. So
Okay.
yeah, I'm looking for questions to go into the chat box because then it lights up on my screen and I see it. And I don't see any just yet.
Commissioner, where can the restaurants and hotels, since that seems to be the biggest one that's going out there, where can they go and get either more information or who can they talk to in Carroll County to assist them?
Well, definitely Jack Lyburn and his team,
Okay.
Paige. To get information on it, you can look up Maryland State Relief Act and see what's been published. There's a letter from Commerce Secretary Schultz, and then the breakdown of dollars, they're going to each jurisdiction across the state.
So if they want to call and ask questions, though, they can go to Jack Liburn's office?
Absolutely. Yep.
Great.
And then I would imagine when there's an announcement to be made, you guys will blast out an email, which is normally what's happened, and then we'll shoot it out to everybody.
Yeah, we try to, and we try to also get it out to the newspaper and online to you, to as many as we can. It's just, there's a lot out there and we all know that. So.
Yep. Very good.
What else? Anything? Okay. Again, I appreciate the opportunity, Mike. Sorry if I sounded rushed. I just want to get as much
good.
out there.
That's
Okay.
fine. You can hang around. We'll see how long Ed goes, and when he's finished, if there's any more questions. So, all right. Thank you.
Okay, thanks.
So now we're going to move, and I want to introduce you to a guy who I don't think saw it coming by a long shot, but his job got really crazy, right? Can you imagine being the actual health officer anywhere in the US and trying to navigate through COVID-19? But it did get him to be Carroll Magazine's Carroll County Person of the Year for last year. And I'm talking about Ed Singer. Ed, they're all yours. Thank you for being here with us today and for all the hard work that you've been doing.
Thanks, Mike. And it's been an incredible year, quite a struggle. And I really have to thank my staff and all the people in the community. We've had a lot of nonprofit organizations, volunteers, and all that have supported us through this pandemic. And a lot of it, there's been a lot of unhappiness with restrictions, and it's been very difficult on businesses. But the thing I wanted to start with here, wanted to start by thanking Commissioner Rothstein for being on. It's been a great partnership with the county, and I was glad we could be on together again today. And the support that they provided in all of our efforts, whether it's been testing, vaccinations, contact tracing, whatever it's been. I've reached out to them, and they're people in recreation and parks, and their citizen services department and public works and all have really supported our effort. And along with volunteers in the community, it's been quite a community effort. The hospital's been a big part of it, and just the number of people that we've worked with during this whole pandemic has been pretty incredible. But we talk about the pandemic, and we think about a lot of the executive orders that were issued by the governor and how that's impacted businesses and things of that nature. And the first thing I really wanted to start with was with the chamber was thanking all the businesses for what you all have done during this pandemic. It was, and the one thing that's always difficult is it's always dangerous when the governor's going to have a press conference. It's like, oh no, what's he going to say now, and how do we have to adjust to it? And in the early parts, it was like, okay, what new restrictions are going into place, and what are the businesses going to have to do, and what are the rules they're going to have to follow? And then as it moved on, it's okay, so what restrictions are being lifted, and how does that impact people and whatnot? And I know the businesses have been working very closely with their environmental health staff to ensure that they have COVID safety protocols in place. And it's really been great here in Carroll County, because I've talked to some of the people in other jurisdictions and how things have been with their businesses. And quite frankly, I'm very pleased to say that we issued a total of 5 what we call notices of immediate compliance, where we had people who weren't complying with the COVID requirements. And 3 of those were just specifically with very small businesses that had issues with the whole mask and mandate order, and they wanted to push the limits just to see how far they could go before we had a problem. But really, I think us only having to issue 5 orders for all the businesses in Carroll County, and as many businesses as that would be, I think that's great, because we really want to, one of the things I've always emphasized to my staff here is we really want to have a good relationship with the businesses, whether it's the restaurants we regulate or the building industry or whoever it is that we're involved in regulating. It's important that we do education first, and that we make people understand, why something's important from a public health perspective, and why we're doing that, as opposed to just come in and say, no, you can't do that. It's important to understand the whys and why it's important to your customers. And I really think the businesses here in Carroll County have gone a long way to make sure that customers could be safe throughout this pandemic. Even when we were in total lockdown, the businesses that were still open, the protocols that they had to follow with disinfecting things and spacing people out and the additional staff that took. It's been a hard year for all of us. And well, I've been extremely busy in dealing with all the things that have to do with COVID. I know the businesses have been busy trying to make plans, and it's really hard when you don't know what's coming next to figure out, how to make something work in a business plan, I think, for you guys. So I just say kudos to you for all that you're doing. And we're getting there. This vaccination process is going to make a big difference. And we've really been kind of restricted on the amount of vaccine that's been available up to this point. But I think that's really changing. And as I get into sharing some slides with you, I'll talk about that a little bit more. But I just want to share with you guys something that I really, I like things that are practical and kind of make sense to me. And I was listening to Dr. Fauci talk the other day, and he was talking about how we're almost to the end zone. It's like that 100-yard, 99 or 100-yard touchdown somebody's running for, and we're getting very close to the end zone. And I know you've seen this on ESPN's blooper reels and things like that before. The thing we don't want to do is spike the ball at the 1-yard line and then not score. And we're very close. There's still things that we need to do. We've got several more months to get through this, I think. Maybe by the fall, we'll be back closer to normal. There still are some executive orders that are in place, and some things look different. And how do those impact your businesses, and what do we have to do, and that type of thing. And I'll just share with you, our numbers are up a bit, and I'm going to share those on a PowerPoint presentation in just a minute. But I want to share a couple of examples of things that we've seen here in Carroll County. And it's just, I guess, my message that we can't become complacent. We had a funeral at one of the facilities here in Carroll County where people came to, and you feel safe with your family, but it only takes one person that has COVID to spread it to a bunch of other people. And during this funeral, we actually have an outbreak investigation that was open because we wound up with a whole bunch of people that were sick and wound up contracting COVID. But 5 of those people wound up in the hospital, and 1 of those people wound up dying. So it's not bad enough that people are dealing with grief. And I know it's been hard during this during this COVID period for people to even deal with losing loved ones and whatnot. But it's important that we still follow some safety protocols and try to stick to our own pods and be careful. Even if you're at a funeral, it just takes one person. And, we don't need 5 additional family members and friends and in a hospital and another person dying to have another funeral to give us the message that, we still need to be careful. And there was a wrestling tournament that was held up in Pennsylvania, and a bunch of people in Carroll County went. It wasn't the wrestlers that actually wound up spreading COVID. It was the parents who decided they were going to get together and talk to each other and socialize and whatnot during this wrestling tournament. And we wound up with a huge number of cases in Carroll County that were related to people going to this wrestling tournament. And I'm not saying that we shouldn't be doing these events, because we all want to get back to closer to normal. I think we just need to be careful and safe about the things that we're doing. And that kind of leads me into a whole thing that's one of the things that's coming up now that I think is going to be one of the biggest challenges for us is just that we're getting into that festival season where everybody wants to be outside. And, we normally have, there's a stroll down Main Street in Westminster, and there's the Maryland Wine Festival and food truck festivals and things of that nature. And, there's nothing in the executive orders that prevent people from having these type of events right now. And our environmental health staff have been working with a lot of people to have these type of events and what protocols need to be put in place and having a COVID safety plan and that type of thing. And we'd be glad to work with anybody that wants to do this type of event and try to figure out how to plan it and do it safely. But these events are going to look a little bit different right now. And that is that essentially under the current executive orders, if you have a food license, whether it's a temporary license from the health department or a permanent license from the health department to serve food, people are expected to take the food, sit down someplace, eat it, drink, take their mask off there, and kind of stick to their pods. I envision myself, I can remember when some of these festivals in Westminster, you got a beer in this hand, you got a hot dog in this hand, you're wandering down the street, you're talking to people, you're eating and drinking. Well, it's going to have to look a little bit different right now. And, maybe by the time we get to the wine festival in the fall, it won't have to look like this. But the expectation is that if you're served food and if you're serving food, the people have a place to go and sit, then they can take their mask off, they can sit and eat and drink. And that way they're not walking around and potentially spreading the virus in an airborne fashion to each other. So that's still a requirement. It's something that we're going to have to work with a lot of people who are wanting to have these festivals, and we're going to work with people as they want to do these things to try to come up with a safe plan. And that one's a little bit difficult right now, and I'm sure it's controversial. I know when we first did masks, that was a huge controversy in and of itself, and a lot of people were concerned about that. We just need to make sure we've got ways to keep from spreading this until, again, we get a large percentage of the population vaccinated, and we can move on and do things safely without some of these restrictions. So I'm going to just share a little bit of data, and so you all should be able to. I hit share, and it's okay. It's lagging a little bit, and I'm not sure whether that's my computer or just the. I got the spinning wheel of death. Now, I did share these with the community media center folks in case we had an issue. Oh boy. Hey, Mike, can you still hear me?
I can still hear you. Yes. Technology is a wonderful thing, isn't it? We practiced this yesterday. Everything worked perfectly. I know the people from CMC might have these slides. If they do and they can find them and they want to share them. Otherwise, maybe what you could do.
My screen's kind of frozen and says Google Chrome is not responding.
Well, maybe, Ed, maybe what you could do is just start to describe what the slides say to us, and then maybe if
I think I can do that. And if unfortunately, I think my computer's sitting here spinning its wheels. Okay. So one of the things that one of the slides I wanted to share, it kind of shows where the number of cases have been in Carroll County over the whole entire pandemic. And you see a relatively a line that's a little bit up and down until we get into November. And when we hit November, there's kind of this huge peak in cases that happened throughout the holidays. And then things came back down into late February, but now we're ticking back up again. And our case numbers now are somewhere around 250 cases of COVID, which is higher than any point prior to Thanksgiving timeframe that we had during this entire pandemic. So I guess my overall message is this isn't over, and I wanted to make sure that I could share with people kind of where our case data was. But again, I'm not even sure if I'm going to be able to get myself back on the screen when this is all said and done. I'm going to try hitting, see if this will let me at least try Task Manager and see if it'll let me end what's not working. Well, I'm afraid if I end what's not working, it might completely take me off the screen.
Well, so, Ed, if for some reason you're off the screen, just dial back in. We've had problems at live meetings too, right? Where microphones don't work. So don't worry about it. We're all here. We're just trying to get some info.
Let me see if, well, it won't even let me close Zoom.
Well, try not to close Zoom if you don't have to, because then you will be gone. And then I'll have to give the rest of your message. I'll say everything's opened up back to normal.
I can come right back on, right back on, and yeah, this is not letting me do anything. Well, let's see what we can do here. It's going to end, and I'll come right back.
I think we lost him. So we'll see where this thing goes. We'll wait for him to come back. This is a live meeting, obviously. So this is what happens. It's like a live concert. We're not here trying to like lip sync. Sheri's saying that CMC maybe never got the actual slides. Okay, well, we'll bring him back. Commissioner Rothstein, are you still with us, or have you already taken off? Because I know you were going to be leaving soon.
I am still here.
Anything you want? But you're not in your seat. It's an empty chair.
I'm in my chair.
There you are. I don't know. Is there anything else you want to add? Because I could give my spiel keeping your money local and try not to spend everything with Amazon, but I usually save that for the end.
Well, we always got to keep it local.
Exactly.
Not a whole lot more to share, except I don't know if Ed talked about.
He's back.
Yeah,
now.
I know. But Ed, if you can, just share with the community, we're in 1B moving to 1C. Where are other places for folks to be getting vaccinated? Because now we're moving out of that surgical approach, like you and I talked about, and, get it out. Everybody and anybody roll up those sleeves and get vaccinated. So if I can throw that out to you, Ed, I'd appreciate it.
Yep, that's one of the slides that I had on here that I wanted to share. It was exactly what I discussed with you all as commissioners this morning. Can the Community Media Center share this, or should I try again and we'll see what happens?
They indicated that they did not receive the slides. So maybe you were having technical difficulty when you sent them because they don't have them. Oh, I got it now.
Okay.
I can
So
see it.
let's just real quick. I'm going to recap what I was saying. This is our cases by week report. And it has, it shows back here from the very beginning when we thought we were seeing a lot of cases, we were less than 100 for the most part. And we peaked up the most around May, about 150. And then up until November, we had not seen 150 cases. But then as we got into around Thanksgiving timeframe, things went way up with cases, and they've come back down, and now we're back up on an upswing again. And we really need to work to keep those case levels from rising. And this is just the next slide on here is just this is a 14-day rolling average of cases. And you can see, we kind of went up through that big peak over the holidays and we're back down and up again. This is just the deaths that we've had related to COVID. And I just wanted to share that briefly. The good news is nobody died last week, but we had over the summertime, we didn't have a lot of deaths. Over the holidays, we did. Obviously, in the beginning of the pandemic, we had a lot of people dying in nursing homes, and the orange lines are the facility-related cases. The blue lines are people that actually died that were living out in the community. This is the pyramid, and I think this is what Commissioner Rothstein was want me to talk about, and it is something that I really wanted to share with you all most because this does have an impact on businesses and some of what I wanted to talk about. This is where we may get questions later, but we've really been focused on phase 1B because the people there were the most at risk. And because the health department had only been getting about 1,000 doses a week, it really took us a long time to get through this phase 1B. The first responders and healthcare workers were the first to be vaccinated, and we vaccinated some of those. But we were really focusing on the 75 plus older adult population. And those people who don't have technology, we made all kinds of phone calls and registering people by phone. So far there've been over 8,700 people, 8,779 estimated vaccinated that are over the age of 75. We've got about 600 or 700 more that are registered to be vaccinated. And I think once we get up around 85, 90% of these people, the rest probably don't want to be vaccinated. There are going to be some people who don't want to be vaccinated, but we've actually had the opportunity in conjunction with LifeBridge. I really want to thank them. They gave us roughly 2,400 additional doses this week to be able to make sure we could go to all four ends of the county, everywhere from Eldersburg, Tonytown, Mount Airy, and Hampstead to provide vaccinations, as well as in Westminster. And we're one of the only jurisdictions that's not having a single site. We've kind of got our primary base of operations is in Westminster, but each week we're trying to make sure we get out to another part of the county so that people who are over 75 don't have to drive so far. So the other people in 1B, and the state's been in 1C, so it's been frustrating for the 65 to 74-year-old people and the other essential workers. But the other part of 1B we've been working on is continuity of government and the higher education and the public schools. At this point in time, everybody who's in that group has been offered the opportunity to get vaccinated. There may be onesies and twosies that weren't able to get vaccinated because they weren't available at the time. But essentially, we finally have finished up with 1B. And again, thanking the hospital for some additional doses so that we could make sure that we offered an opportunity for everybody in that group to get vaccinated. So we've moved on and sent out invitations to all the people who are 65 to 74 who are on our interest list to offer them to be vaccinated. And so that's an important piece because now we're getting ready to move into offering vaccination to essential workers. And exactly what that is confusing to everybody. But essentially what we're talking about And it's different than the essential businesses. When you look in the CDC website and the state's website about what these essential workers are, it's specifically grocery stores, essential manufacturing. So we want to reach out to the manufacturing community, the grocery stores, food manufacturing. So it'd be places like Hahn's and Fuchs and any other place that's doing food manufacturing. And places like that. It also includes potentially lawyers, veterinarians, and the press are in these essential worker categories. Now, the things that it doesn't include right now, which is going to have people upset with me again, but this is where we are on this, is it does not include the food service and restaurant industry. It does not include retail, and it does not include like home builders and landscapers and things of that nature. And while those businesses were allowed to operate as essential businesses, they're not part of that prioritization in 1C of this phase. And we're going to be asking, we're going to be trying to register people who are in grocery stores and in these manufacturing and industry and agriculture as we're moving through this. And we're going to ask them to do is have an employer ID. We're not doing the honor system like the state is, because I think the state sites, their mass vaccination sites, they're essentially taking your word for it and letting you come in. And if we're going to have priority groups, in my mind, it doesn't make any sense unless we ask people to show how they fit in the priority group. So we'll either want the person to have an ID from their employer, they can bring in a pay stub, or they can bring a letter from their employer saying, I work in Miller's grocery store up in Westminster, in Manchester, Westminster, or wherever that would be. So we're going to be trying to reach those people in this group. I think vaccines becoming more and more available, and the governor's having a press conference at 2 today, and I wouldn't be surprised if he opened things up statewide. We had originally focused specifically on 1B because if you look at our data, I think about 95% of the people who had been dying from this disease or were hospitalized were over the age of 75. So we thought it was very important that we reach them first. And a lot of people were very frustrated that we didn't move into 1C right away when the governor said we can move into 1C. He also told local health departments that if we felt it was necessary, we could stick with 1B. And we've been doing things like reaching the homebound, working with LifeBridge to send people out to the houses where people cannot leave their home, that are essentially stuck in their houses. We've gone to communities that are hard to reach where people have difficulty with mobility. And the county's been providing transportation to people that don't have transportation to get them to vaccination clinics. So we've made a lot of effort to try to reach those very hard to reach people. And I think we've really gotten through this list to a great extent. And now we're trying to reach the essential businesses. And the other thing that we're going to be trying to do is, while it's not specifically specified in 1C, there are people who are receiving hospital-based treatments that have underlying health conditions that are supposed to be in 1C, and they haven't necessarily been prioritized very well by the hospitals. So we're going to be accepting doctors' notes for those people and allowing them to be vaccinated. And we're also, with the same types of conditions, we've got dialysis centers that aren't necessarily associated with the hospitals, but we want to be able to reach those people too, because they're at very high risk. And as things gradually open up, what we're going to be doing is we're going to be initially trying to reach out to those people that are in the highest risk groups and try to register them first, but then also opening up additional slots to people in the general public, depending on where the state is in their priorities with vaccination. So I wanted to specifically share that with you and let you know kind of where we were on those things.
Ed, we've got a couple of questions that this might be a good time to ask because it goes right with what you were talking about. Could I just maybe read them to you?
Sure, we can hit the questions that as you would like to have them answered.
All right, these just came up when you were talking, so it seems like this would be a good time to answer them. I have Karen Pelton from Carroll Community College saying, what about caregivers that technically fall in phase 3, i.e. child taking care of an elderly family member who lives with them? So that's one question. And I have two more if you want to tackle that first one.
Well, the first one's really easy. That falls into a different phase, and we haven't gotten to that phase yet. And that's a question that a lot of people have been asking us. And, those people who are vulnerable that, the one piece that I missed was the DDA folks, people with developmental disabilities or intellectual disabilities. We're also prioritizing them to be vaccinated, but the caregivers, they're really not at more risk than the general public. If we can get the people with the health conditions, and everybody's trying to ring me on my cell phone, and then my office phone rings. Sorry, I don't have a way to mute that one.
You're a busy man.
Anyway, but the caregivers are not in the priority group right now, and they have to get vaccinated in wherever their own priority group was, if it's with age or whatever their employment might be. And okay. But that's the caregivers are not in a special priority group, and we can't prioritize them for vaccination, and they're going to have to fit wherever their priority group is, either based on age or other circumstances that might prioritize them.
Okay, and then we had one other question from John saying, does it include energy services and HVAC folks, people that would do repairs to your HVAC system?
So it includes infrastructure workers. So we're talking like BGE, those folks that have a broader infrastructure approach. But really, unless you're in a high risk setting, so if you're an HVAC worker that's in a hospital, the hospital is going to prioritize you as part of their medical operation. But if you're essentially going into people's homes, you're not having a lot of contact. Now, postal workers are prioritized because they're going around house to house to house and having contact with a whole bunch of different people, and that's why they're in this priority group. But essentially, HVAC workers, it's possible for you to have contact with the homeowner, keep socially distanced, not have 15 minutes of close contact with the person, and go on and do the work. So the reason that generally HVAC workers are not prioritized is because there's not a level of high contact. The one that I'm kind of uncomfortable with and I keep thinking about is technically people in retail like Lowe's and Home Depot and those large stores where they've been open for all this time and there have been a lot of people in and out of there. They're not technically on the priority list. And that one, I don't know that I fully agree with where the state and the federal government are on that one, because there is a high level of contact. And we consider the supplies that people to get from there to be essential supplies that people need. And I've been trying to wrap my head around what we ought to be doing with places like that. But in general, we're trying to look at what the level of contact is that people have to have with other people in the community and how much risk of spread there is. And that's why certain essential businesses are in this priority group. For instance, I'll throw out there, I just know English American Tailor. I've been over there. I know those people have to be close together, and there's no other choice than, they're working side by side. And if it spreads through there, that's going to cause a lot of cases of COVID in our community, which could spread to other people in the community at large. Or like Hans, we've been in their operation, and while they've done everything they can to mitigate COVID, there's nothing you can do in their manufacturing process where people can be spread out. So what we're trying to consider when we're looking at these priority groups is how much risk there is. If one person gets COVID, how much risk is it that they're going to spread it to a bunch of other people, and what impact is that going to have on the community? So the HVAC workers, while I appreciate what they do, and I think they're absolutely critical to us and our economy, I just don't think that they're a high risk of being super spreaders of spreading the virus around to a whole bunch of people.
Ed, thank you. And one last question, actually, just looking for info on this. Chris King is asking, can we get the contact info for the team providing vaccines in the home for homebound residents? Is that on your website if people go there?
So the way we're handling that is specifically because I want to make sure that people are truly homebound that we're reaching, because, here in Carroll County, one of the things we actually, there's an ABC News piece that they interviewed LifeBridge and they interviewed us because we're working with LifeBridge's team and their nurses have been helping us with this. But it's a heavy lift because in Baltimore City, you can go to an apartment building and you hit a whole bunch of homebound people in that apartment building. In Carroll County, you got to vaccinate somebody, wait 15 minutes with them to see if they have a reaction, and then you have to drive 12 miles to go to somebody else who's homebound. So I'm going to answer this question in just a minute, but it is we've reached 60 of those people so far in conjunction with LifeBridge who actually can't get out of the house. But in order to have somebody prioritized who's homebound, we want them prioritized by 3 different organizations. You can either have them prioritized through social services if they're working with social services for anything that they would need, or they can work with the county Citizen Services Department and Bureau of Aging. Those people have the ability to assess whether people are truly homebound or not. And they can work with the health department's adult evaluation and referral services. So we're dealing with those on a case-by-case basis, but working with those 3 agencies to actually evaluate whether somebody's homebound or not. Because I do get a lot of people who say, my dad doesn't leave his house very often. Well, if he leaves his house to go grocery shopping or whatever else, that doesn't mean they're homebound. So, you know, we want to keep this list small so that we can manage it and get people who truly cannot leave their house. But we also want to make sure that everybody who wants an opportunity to get vaccinated has that opportunity to get vaccinated. So we're asking that you reach out to one of those 3 agencies to help you get prioritized. And if you're having difficulty with that, you can certainly shoot me an email. My email is ed.singer@Maryland, spell out the word Maryland.gov. It's pretty easy. Somebody can put it in the chat if you want, but it's just my first name, ed.singer@Maryland.gov. And I'll figure out how to link you up with somebody who can help you with that assessment, because we really don't have the ability to assess every person who thinks that they're homebound. And these agencies deal with the appropriate level of care and whether somebody really needs to be in a nursing home or whether they can live in their own home with certain supports and things like that. And they evaluate people for this type of situation every day. Does that make sense?
Sounds very good. Thank you. All right.
Okay. So I was actually almost done with this slideshow. This just is our website. We've got a lot of information on the website. There are interest forms and other forms on the website. Right now, I actually threw out in the commissioners meeting, and my staff say that I'm crazy. I threw out my phone number and my email. If you know anybody that's over 75 or know anybody with developmental or intellectual disabilities that has not been vaccinated and they want to get vaccinated, you can call me personally at 410-876-4974. And I can't always answer the phone because I might be on one of these Zoom calls and then the phone rings and I can't answer it. So I took it off the hook so it doesn't ring anymore. Or you can contact me by email at the same email address that I gave you, and I'll make sure that somebody reaches out to these people and helps them get scheduled. We have plenty of vaccine to vaccinate anybody that's over 75. I think we got plenty of vaccine to vaccinate anybody that's over 65, thanks to the LifeBridge, but that's a little bit of a different process. You call our call center and put your name on our interest form and look for an email over the next week that we're going to be sending out to the people that are 65 plus. But we can help you, if you don't have technology, we can also help you that way, but you just need to call our call center. But the people that I would want to call me intellectually disabled or developmentally disabled or people over 75, if you know somebody, have them reach out to me because I'll personally make sure that they get registered, because they're our most at-risk people that we want to make sure have an opportunity to be vaccinated, and we can certainly assist with that. So this is our website. There's a lot of information out there. There's actually information on our website, and I got to figure out how to, I guess, stop sharing. Oops.
That did it.
That did it? Okay.
Yep,
great.
Good.
But there's a lot of information on our website that we've tried to provide that give links to other places to get vaccinated, because if you're not in our priority group that we're vaccinating and you want to register at the state website or through LifeBridge or through someplace else, we want to make sure people have that opportunity. And again, I can't thank LifeBridge enough, because we really had a hard time getting through 1B because we didn't have enough vaccine. That little bit of an extra boost that they gave us, that gave us basically more than 2.5 times what we're normally getting in a week for our to reach out to those priority groups, will help us get into the general population in the very near future. And I really think the governor's likely to say something this afternoon about opening up to other to additional people. And I think, the president's talked about wanting to have an opportunity for people to get vaccinated, everybody that's over 18 to start getting vaccinated beginning May 1st. So I think that July timeframe that the president put out there is probably relatively reasonable, that we could be back closer to normal by then. if we get, I think the goal is to get 70 to 80% of the population vaccinated. There are more vaccines coming on board. There's more availability of some of these vaccines, and production's ramping up. So I think we're really going to be able to get there. We just need to work through this for the next several months and try to put an end to this thing, because I'm tired and I want to get back to normal life. And I know all of you do too. And I know the profound impact it's had economically on all the businesses here in the county, and looking forward to seeing us all get back closer to normal. So that was essentially the parts that I wanted to say, and I'd be glad to talk about anything that anybody would have questions about, or if there are specific things that you just want me to talk a little bit more about, just let me know. And I'm going to stop there and give the opportunity for people to ask questions or tell me there's something else you want to hear about.
Thanks, Ed. We do have one person who typed in here. Can you give us a contact person at Carroll County Health Department regarding the new visitation guidance for nursing homes / assisted living facilities? So is there a contact person, or can you go over it real fast?
That's really primarily a state function. If what I'll do, Mike, and I'm going to figure out who a good contact person would be to have people work with from this group here. And do you have the ability to push an email maybe out to folks that would want to know this in general? Because at one point in time, we had a liaison that was working with all of the nursing homes and those new guidelines. But are we looking from a standpoint of a facility needs to talk to us, or are we talking about, an individual has a question about a parent being in a nursing home?
It looks like a specific person has a question. E.M. Hughes, I don't know if you're still on the call, if you want to let us know. But I mean, it seems to me like if you could get the information to us, Ed, we could push it out. I know if Hogan's doing a press conference, we'll probably have information we'll want to push out to kind of encapsulate what he says. And we could maybe, if we get it in time, we could include it in that email as well.
Okay. Yeah. And it's, generally we've tried to have somebody coordinate between the state and the facilities and also the people who have loved ones who are in these nursing homes. We didn't write the order. We don't have to implement the order. The nursing homes do. And the state's essentially enforcing the order, but we want to help people in Carroll County be able to navigate what those orders are. If they have questions about it, at least find the right people to get them answers. So I'll get you a point of contact in the next half an hour so that you have it.
Ed, excuse me, this is Chris King. I'm not sure what angle the question is coming from, but each nursing home has its own set of standards. So if it's about visiting, they may want to contact them directly to find out what their process is.
Right. And most of the questions that we've got that we've tried to help with is our nursing home won't move forward with allowing visitation. And then we've kind of tried to be the intermediary. And now the county actually has advocates in the Office of Aging and probably those ombudsmen are the best people to work with. But we also like to make sure, I don't know, as a health department, I like to have a no wrong door policy. So if somebody wants to call us, I want to be able to have somebody help them figure out their problem. So I'm going to come up with a point of contact for people to call. I just want to make sure that I pick the right person that can do this for people.
Thank you very much. And I did want to ask you a question. When you're showing the numbers as far as how many positive cases, I'm assuming that means there were tests done, some are negative, some are not. Is that information being gathered by everybody who's testing? Because I know there's a lot of different places that are doing the testing, or is that just the health department, or do they all funnel the information into you?
So under state law, this is a communicable disease and it's required to be reported into a system they call NEDS. And we pull all of our information off the state database where it comes in. And this is based on county of residence is where this data is coming from. So those case numbers that I'm showing you are Carroll County residents. Now somebody might work here in Carroll County and they might spread it around in Carroll County, but if they live up in Hanover, they're not in our case numbers. So anybody who's tested, and it's supposed to be at any facility, even if they're tested in Pennsylvania, that's supposed to be reported out to us here in Maryland. I don't know that always happens real well, but all of the urgent cares, and this was a little bit of struggle for them at first because they didn't routinely do this kind of testing. The doctor's offices, the hospital, our testing site, anybody who's doing testing for COVID is supposed to report this into the system, and we get that information almost immediately.
Okay, thanks. I was just kind of wondering.
And that actually helps us. That feeds into our whole contact tracing thing, because we find out who's positive. We call the person who have you had close contact with, who needs to stay home so they don't make other people sick. So there's a huge data system to pull this all together, and this one works well. Unfortunately, the scheduling for the testing, I mean for the vaccination, hasn't been the best system, and we have to use what the state gave us. But what I'll say about the testing is, once you get through the registration process, when you actually come to the vaccination site, it's painless. It's just right now, just trying to get things organized so that we get the appropriate people vaccinated has been a struggle.
Okay, I don't know if there are any other questions. If there are, now's the time. Put it in the chat box. I appreciate you taking time out of your day. I know you're a busy, busy man, to give us some updates on this, and we're all excited about the fact that really we're looking forward to the day when whoever wants to get the vaccine can have it and can say that they had it, and we can get back to some semblance of being normal again, although that's not always a good thing either. So so I don't know that there are any more questions. I don't think so. I know that Julie from Alzheimer's just put up another link again for the walk that they're doing. And other than that, I want to just thank you for being here with us. Is there any last thing you want to say, Ed? Or
the only thing I'd say, Mike, is I'd like to thank you and the chamber for this opportunity to talk to people. There's nothing more important than getting the most current information out there to people in the community, help people understand why certain things are the way that they are. And this was a great opportunity for us to share what's going on, and really appreciate it. Whether you like or hate what we're doing, at least you can know some of the why and reasoning behind what we're trying to do to limit the spread of this in the community. And thank God we're getting towards that end zone, but don't spike the ball prematurely. Thanks, everybody.
that's a good analogy. Thank you. And a lot of people are saying thank you, thank you. So we're all going to give you some applause here. Appreciate it and look very much forward to the day. Don't forget our first live luncheon, May 20th, and it will fill up. It's not filled up yet because I don't think people are even thinking about a live one, but we have limited space, and we've also got limited space for Leadership Carroll. Even though we went through COVID, we've still been doing leadership this whole year. We had to cancel a couple, but we've reset them. We're doing 2 in April, and then we're doing 2 in June. But Jim Ball, good time for me to sing, "Oh Danny Boy." That would have been yesterday. So Jim, thank you for that. Again, thank you guys all for being a part of the call here, for being part of the chamber, for being part of this amazing community that we live in, that gives back so much and takes care of everyone. This is the time where we all got to pull together. We'll get through this. It's been a year. We're going to get through this thing. So thank you all so much. And again, thank you to CMC, our sponsors, Ed Singer, Commissioner Rothstein, you guys, thank you. And with that, I'll say have a wonderful afternoon. Thanks.